Good morning, everyone. Today, we will discuss documentation of perioperative patient care, incident reporting, legal aspects of medical devices, and ethical issues in operation theater nursing. Perioperative nursing is a highly specialized field where patient safety, legal accountability, and ethical practice are closely interconnected. Every assessment, intervention, observation, and significant event that occurs during the surgical experience must be accurately documented to ensure continuity and quality of care. Documentation is much more than record keeping. It serves as an essential communication tool among healthcare professionals and provides a permanent record of the care delivered to the patient. Accurate documentation supports clinical decision making, promotes patient safety, and contributes to effective teamwork within the surgical environment. In addition, documentation serves as legal evidence of the care provided. Therefore, maintaining complete, accurate, and timely records is a professional responsibility of every perioperative nurse. In this session, we will examine the importance and standards of documentation, various methods of charting, the requirements of perioperative records, the role of incident reporting in patient safety and risk management, the regulation and legal aspects of medical devices, and the ethical principles that guide professional nursing practice in the operation theater. By understanding these concepts, nurses can enhance patient safety, maintain professional accountability, and contribute to the delivery of high-quality perioperative care. Documentation is often described as the backbone of professional nursing practice because it provides a permanent and reliable record of the care delivered to patients. While verbal communication is important, it may be forgotten, misunderstood, or misinterpreted over time. Documentation ensures that critical patient information is accurately preserved and readily available when needed. The patient's chart tells the complete story of the patient's clinical journey. It includes assessments, nursing interventions, treatments provided, patient responses, and significant events that occur throughout the course of care. This information allows surgeons, anesthetists, nurses, and other healthcare professionals to communicate effectively and coordinate patient management. Documentation also plays a vital role in ensuring continuity of care. Accurate records enable healthcare providers to understand the patient's condition, monitor progress, and make informed clinical decisions based on documented evidence. From a legal perspective, documentation is extremely important. Healthcare records are often used as evidence in legal proceedings to demonstrate the care that was provided. Courts frequently consider undocumented care as care that was not performed. Therefore, accurate, complete, and timely documentation protects both the patient and the healthcare professional. In addition, documentation supports quality assurance activities, audits, research, education, and healthcare planning. For these reasons, maintaining accurate documentation is considered a fundamental professional responsibility of every nurse. Certain standards must be followed to ensure that documentation is reliable, accurate, and legally acceptable. High-quality documentation is essential for patient safety, professional accountability, and effective communication within the healthcare team. Documentation should always be factual and based on direct observation, rather than assumptions, interpretations, or personal opinions. Nurses should record only what they see, hear, assess, measure, or perform. Objective documentation increases the credibility and reliability of the patient record. Entries should be made promptly because delays in documentation may result in omissions, inaccuracies, or loss of important information. Every entry should include the date, time, and signature or identification of the person making the record, ensuring accountability and traceability. Documentation should be clear, concise, legible, and complete. Approved abbreviations should be used according to institutional policy to avoid misunderstandings and communication errors. When errors occur, they should be corrected according to established institutional guidelines. Information should never be erased, overwritten, or obliterated because the original entry forms part of the legal record. Corrections should be made in a manner that preserves the original information while clearly indicating the amendment. By adhering to these standards, nurses ensure that documentation remains a trustworthy record of patient care and serves as a valuable clinical, legal, and professional resource. Over the years, several documentation methods have evolved to meet the changing needs of healthcare practice and patient care. Narrative charting is the traditional method of documentation in which patient events, observations, and nursing interventions are recorded in chronological order. This method provides detailed information but may require more time to complete. SOAP charting is a structured method that organizes information into 4 components: subjective data, objective findings, assessment, and plan. This approach promotes systematic documentation and makes patient records easier to review and understand. Problem-oriented medical records, or POMR, focus on identified patient problems and the interventions implemented to address those problems. This method encourages critical thinking and helps healthcare professionals monitor patient progress effectively. Other methods, such as focus charting and exception charting, have also been developed to improve efficiency and emphasize significant patient concerns. Today, many healthcare institutions use electronic documentation systems that integrate several charting approaches into a single platform. These systems improve standardization, enhance communication among healthcare professionals, and support the delivery of safe, efficient, and high-quality patient care. Modern operating rooms increasingly rely on computerized documentation systems and electronic health records to improve efficiency, accuracy, and accessibility of patient information. Electronic records enable healthcare professionals to access patient data quickly and simultaneously from different departments, facilitating better communication and coordination among members of the healthcare team. This reduces delays, minimizes duplication of work, and supports continuity of patient care. Computerized documentation systems also promote the use of standardized terminology, improve the consistency of records, reduce errors associated with illegible handwriting, and provide valuable data for quality improvement, audits, and research activities. In addition, electronic systems can generate alerts, reminders, and decision support tools that assist healthcare professionals in providing safe and evidence-based care. However, the use of electronic records also brings important responsibilities. Nurses must safeguard passwords, maintain patient confidentiality, follow institutional security policies, and ensure that patient information is accessed only by authorized personnel for legitimate clinical purposes. By using computerized documentation effectively and responsibly, perioperative nurses can enhance patient safety, improve communication, and can contribute to the delivery of high-quality healthcare services. Perioperative documentation begins before the patient enters the operating room and continues until the patient is safely transferred to the recovery area. It is a continuous process that records the patient's entire surgical journey. The perioperative record should include essential preoperative information such as patient identification, informed consent, medical history, physical examination findings, laboratory reports, allergies, and NPO status. These details help ensure that the patient is adequately prepared for surgery and that potential risks are identified before the procedure begins. During surgery, the nurse documents important events and timelines, including patient arrival in the operating room, induction of anesthesia, start and completion of anesthesia, incision time, closure time, and transfer from the operating room. Accurate recording of these events provides a clear account of the surgical procedure. The documentation should also include medications administered, skin preparation methods, patient positioning, use of surgical devices, specimen collection and handling, instrument, needle, and sponge counts, as well as the patient's condition throughout the procedure. Comprehensive and accurate perioperative documentation promotes patient safety, facilitates communication among healthcare professionals, supports continuity of care, and serves as an important legal record of the care provided. Despite careful planning, unexpected events may occur in healthcare settings. When such events occur, incident reporting becomes an essential part of professional nursing practice. An incident report is a separate document used to record unusual occurrences that may affect patient safety, staff safety, equipment functioning, or hospital operations. Examples include medication errors, patient falls, equipment malfunctions, needle stick injuries, and other unexpected incidents. The primary purpose of incident reporting is not to assign blame or punish individuals. Rather, it is a risk management tool that helps healthcare organizations identify hazards, analyze contributing factors, improve systems, and prevent similar incidents from occurring in the future. Incident reports should always be objective, factual, and free from personal opinions or assumptions. The report should clearly describe what happened, when, and where it occurred, the individuals involved, the immediate actions taken, and the persons who were notified. Accurate and timely incident reporting promotes a culture of safety, supports quality improvement initiatives, and ultimately contributes to better patient outcomes and safer healthcare environments. Medical devices play a critical role in modern surgical care. Because these devices directly affect patient outcomes, governments have established strict regulations to ensure their safety and effectiveness. Medical devices are generally classified into 3 categories based on risk. Class 1 devices carry the lowest risk, while Class 3 devices, such as implants and life-supporting devices, require extensive testing and regulatory approval before they can be used in patient care. Healthcare professionals have a responsibility to monitor device performance, follow manufacturer guidelines, and report any adverse events or device malfunctions associated with their use. Proper documentation of device information, including manufacturer details, serial numbers, batch numbers, and implantation records, is essential for patient safety and regulatory compliance. Accurate records also facilitate device tracking, product recalls, and long-term follow-up when necessary. By understanding the legal and regulatory requirements related to medical devices, perioperative nurses contribute to safer surgical procedures, improved patient outcomes, and greater accountability within the healthcare system. Ethics guide decision-making when situations involve values, rights, and professional responsibilities. Respect for patient autonomy means acknowledging the patient's right to make informed decisions about treatment. Confidentiality requires protecting patient information at all times. Beneficence involves acting in the patient's best interest, while non-maleficence means avoiding harm. In the operating room, ethical practice includes maintaining patient dignity, advocating for patient safety,